Okay, so I am approaching the client's room. I have retrieved all of my information, looked at her chart. I've gotten all my supplies. I'm looking to see if there are any isolation placards or anything that I should know about before entering the room. Vital signs have been completed, and I am entering the room. Knock, knock, knock. There. I'm Alex. I am going to be your nurse today, and I'm just here to do an assessment. Can you tell me your name and date of birth, please?
Delaney Jensen, March 27, 2001.
Fantastic. Can I see your wristband? Wonderful. Thank you. And how do you prefer to be called?
Delaney is
Delaney's good. And what are your pronouns?
she, her.
She. Fantastic. Great. Wonderful. So what's bringing you in today?
I just have a post-op follow-up from a couple months ago.
Okay, wonderful. And are you having any pain right now? I should know that? No? Okay. If you were, then I would do an assessment of that, PQRS assessment, and get you medications if you needed it. Glad to hear there's no pain. Great. So let's go ahead and can you tell me where you are right now?
Bellevue Clinic.
Okay, fantastic. And what month and year is it?
July 2024.
Okay, great. And while I'm doing this, I'm noticing that Delaney is making eye contact with me. You're responding appropriately. I'm noticing that you have symmetricality in your features, and you look like you have good perfusion pinkness in your cheeks. Great. And let's see. So we're alert and oriented to self, place, time, and situation. You told me why you're here. So before we go through the assessment, I'm just going to ask you a number of questions. All right. So first off, do you have any past hospitalizations or medical history that I should know about?
Just the surgery.
Just that. Okay, great. Are you allergic to anything, medicine, food, or latex? No? Okay, great. And then just a quick systems check. Any dizziness, headaches, seizures, history of seizures? No numbness or tingling? No? Okay. Any shortness of breath? Any recent coughs or colds? No? Any mucus, sputum, or anything like that? Okay. Any shortness of breath or pain in the chest? Or cardiovascular history that I should know about? No? Okay. Any difficulty with breathing, wheezing? And as I'm asking you this, I'm noticing that your breathing is calm, it's even, it's not labored. I'm also noticing that there are no PIC lines, no central ports that I can see, but I'll reassess later. I'm also noticing that there's no flow as we're going through. Let's see, any abdominal pain at all? No. Any nausea or vomiting? No. Any diarrhea or constipation? No. And in terms of urination, any changes in frequency, urgency, any retention recently? No. No pain or burning with urination?
Nope.
Proper color? Is it cloudy or clear?
Clear.
Okay. And any unusual smells? No. Okay. Great. And then when was your last bowel movement?
2 hours ago.
Fantastic. And urination?
Same time.
Okay. Fantastic. Great. Great. So no abdominal pain. Any other joint pain, difficulties? No. Okay. Any use of assistive devices, either glasses, hearing aids, dentures, walkers? No. And any use of oxygen at home?
I do not.
No. Or do you use an incentive spirometer at home? No. Okay. All right. Any use of tobacco or alcohol? No. Any recreational drug use? No. Okay. What about any anxiety or depression? No. Okay. Great. If there was, I would ask about any suicidal ideations. And would make sure that that is okay for you. Any cultural or spiritual considerations I should take into account?
Nope.
No. Okay, great. Wonderful. I think any other questions that we have, we'll ask along the way. So I'm going to go ahead and start head to toe, starting with head and neck. Again, I'm looking to see symmetry, everything. There's no drooping on one side or the other. Is it okay if I touch? I'm going to go ahead and just do a little bit of an assessment of head. So I'm just checking out the head and feeling for any bumps, lumps, bruises. I'm looking for any skin breakdown. I don't see any. Towards me, great. Everything is looking good. And go ahead and turn to your left for me and turn back this way. Great. And look up for me. I'm assessing to see that the trachea is midline. You can put your head back down. I'm looking for any vessel distension, right or left, and that looks good. Go ahead and swallow for me. Great. So I'm checking just to notice that that our cranial nerve 10 is functioning there. I'm going to go ahead and put my fingers on your carotid artery here and here, just to check your pulses there. And then on the other side. Great. So carotid pulses are both present. They're both even. It's looking good. Temperature of the skin is feeling appropriate. It's warm and dry. Great. So I'm just going to go ahead and go through the cranial nerves a little bit more deeply. First, I'm going to have you, and before you do, I'm just going to explain. I'm going to have you close your eyes. I'm going to do a couple of things. I'm going to put something in your nose. I'm going to touch your face, and I'm going to have you listen for something. So I'm just going to ask you those things while I go through. Okay? Great. So I'm going to have you go ahead and close your eyes. And tell me when you can smell something and what you smell.
Alcohol.
And then go ahead and tell me where I'm touching on your face.
Forehead. Left cheek, right cheek, right cheek, left forehead.
Fantastic. And keep your eyes closed. I'm just going to go ahead and test out your ears. So tell me which side you hear this from.
Right, left, both.
Okay. You can open your eyes for me. This, but I'm just going to do it again. Great. So now I'm going to go through and test your eyes. So let's see, let's do this first. I'm going to have you just keep your gait or your head facing forward and follow my fingers. Sorry, I'm making you dizzy. All right. And then I'm just going to check your pupils to make sure that they are equal, round, reactive, and that they accommodate light. All right. So I'm just going to shine this in your eyes kind of bright. Great. Fantastic. Great. Good and reactive. All right. So we were just testing the nerves 1, 8, 2, 3, 4, and 6. We tested the face with 5 and 7. I'm going to have you go ahead and smile a little bit for me and frown. And then go ahead and squeeze your eyebrows together. And lift your eyebrows and puff out your cheeks. Fantastic. And have you stick your tongue out side to side. And I'm going to go ahead and take a look in there. Have you say ah for me. And I'm just checking out the mouth, see if it's pink, looking at the mucosa to make sure that it's intact and there's no signs of infection or anything else. The uvula, I noticed, moved up and down appropriately. So I'm looking at symmetry of those things, but also testing for the cranial nerves 5 and 7, 8, nope, not 8, 9, 10 and 12, and then I'm going to have you go ahead and I'm going to put my hands on your shoulder. I'm going to have you resist up against me, and then I'm going to have you press your face against my hand from right to left. Okay? So press up, fantastic, and towards me, and towards me. Great. And that's testing cranial nerve 11. Wonderful. So as I'm going through that again, I'm feeling like there's symmetry both sides, looking at your chest, rising and falling easily, skin is warm and dry. I'm just going to go ahead and, let's see, come back onto this. So I'm going to keep on going down through your arms and legs with nerves here. So I'm just going to test, I'm feeling for temperature of the skin, feeling equal and even. I'm going to have you put your arms out in front of you, and I'm going to have you resist up and press down against me here. Up and down. Great. And squeeze my fingers. Fantastic. And I'm going to put the other one down. I'm going to test your capillary refill. Good. Capillary refill. Fantastic. Go ahead and close your eyes for me. Did you feel this? Okay. And what about this? Okay. Great. And go ahead and just wiggle your fingers for me. Wonderful. I'm going to feel your pulses here, feeling radial pulses. They're feeling even. And I'm going to check your brachial pulses. Wonderful. Feeling bilaterally even. Great, we'll do that. All right, and then I'm going to come on down, feeling legs. Again, temperature feels even throughout. I'm noticing there's no edema, so don't need to worry about that. I'm going to come down and check your dorsal pedal pulses. They're feeling good at 2+. All the pulses have been 2+ so far. And I'm feeling posterior tibialis pulse. Good. And both of those, I'm going to have you press against my hands and bring them back towards you. Wiggle your toes. Great. And I'm going to do capillary refill. Looking good. Less than 3 seconds capillary refill coming back, which is fantastic. I'm going to have you go ahead and raise one leg. Hold you there for 10 seconds. I'm going to have you resist against me down below and back up. Great. And down. And same on the other side. 10 seconds up, resist down, push up. Great. And if there was edema, I would check to see what staging of putting edema or edema there was, but there is not, which is fantastic. Great. And I'm going to come on back up and we're going to go ahead and just do a review of the organ systems. So I'm just going to go ahead and palpate your chest. I'm going to look for any crepitus, any vibrations, any swelling, bumps. And then I'm going to listen to your lungs. And then after that, I'm going to listen to your heart. And then we'll come down to your belly and we'll listen to your heart. Okay? All right. So I'm just going to feel chest. Feeling for any crepitus, any swelling. I don't feel any. Skin temperature feels even. Skin coloration is appropriate for ethnicity. And I'm going to have you, I'm going to bring down your gown a little bit here. Is that okay?
Yeah, that's fine.
Wonderful. So as I go through, just go ahead and breathe normally. You're going to take deep breaths, but at your own rate.
Okay.
And for the sake of the brevity of this video, I'm just going to go ahead and feel at the spots that I'm listening to. I'm going to go in between the costal bones, making sure to listen as I go, and around the lobes. So I'm going to start up above. Listen, should take a deep breath in and out, and then out. Comparing sides, side to side. And I might have her lift her breasts for me so that I can get underneath. Listening from side to side, or I would go ahead and lift with the back of my hand, around on the side, listen to the side, fantastic. And then I'm going to have you go ahead and lean forward for me and do the same thing on the back, just palpating, feeling for any crepitus, swelling, looking at the skin for any skin breakdown. While I'm here, I can look at the sacrum and see that there's no skin breakdown on the points where the hips meet. Everything is looking good, feeling warm and dry. And I'm going to go ahead and listen on the back as well. So she would breathe in and out, breathe in and out. I would take more time. I am moving my stethoscope around the scapula. Great. And I'm listening for any crackles or raspiness. I'm listening for lack of sounds, which might show atelectasis. And everything sounds clear, which is great. So I'm going to have you go ahead and lean back, and I'm going to listen to your heart, and then we can put the upper part of your gown back up. So I'm going to listen to a few areas here. We're going to be listening to. So we're checking out second intercostal space to the right side of the sternum. We're listening for the aortic valve. Same size, same level on the other side is the pulmonary valve. Then here in the fourth intercostal space, listening to the tricuspid just off to the side of the sternum. And then we're listening to the mitral valve in the fifth intercostal space along the midclavicular line. Right. Great. And then we're going to turn the stethoscope around to listen with the bell for lower sounds. So we're going to listen back to the mitral valve. Sounds good. Listen to tricuspid. And we're going to listen to the pulmonary. And the aortic. Great. Everything's sounding good. Wonderful. So we can go ahead and put this back up. Okay. Go ahead and, can I expose your belly? Okay. So we're going to take a look at your belly. I'm just looking to check and see if there's any abdominal distension, any wounds, any drains, any lines, any ostomies. I see nothing. I would look to see if the bladder is distended. I'm noticing that there is no Foley. Before I touch, I'm going to go ahead and listen. I'm going to listen in 4 quadrants. I'm going to listen to the lower right, upper left, lower left for bowel sounds for 1 minute in each quadrant. If I don't hear anything for 1 minute, I'm going to listen for 5. And if I don't hear anything, any bowel sounds within that time, I will contact your provider because that's an abnormal finding. But for now, we're going to listen to the lower right quadrant and upper right quadrant, hearing bowel sounds in each. I would listen for a minute, but I don't need to right now. Great, so all bowel sounds are there. I'm going to go ahead and palpate gently in those 4 quadrants. Let me know if there's any discomfort, okay? So I'm going to palpate gently. Not feeling anything unusual. I'm feeling temperature is normal. There's no lumps, bumps, masses that I'm feeling, anything like that, any skin breakdown or ulcers. I'm going to press in a little bit more deeply. If there's any pain, again, let me know. Okay? And if there was reason to, or if there was pain in a certain area, I might go ahead and do some rebound testing for pain. So I might press in and then let go and see if there was rebound tenderness. Any rebound tenderness? Great. Okay, and then while I'm here, I'm going to go ahead and palpate down to see if we can feel the bladder, which sometimes you can, sometimes you cannot. And we already asked about bladder and urinary issues. If there was a Foley, then I would inspect your peri area just to make sure. I might do some Foley care, but I would also just inspect just to make sure that that there was no skin breakdown and no signs of infection. Wonderful. Okay. Thinking through. Great. Okay, so let's have you go ahead then and nice and slow come around and put your feet on the ground for me. Any dizziness at all? No? Okay, great. When you're ready, I'm going to have you stand up and face me. And go ahead and put your feet together. And
18.
let your arms dangle by your side. And I'm going to have you close your eyes and balance for me for 30 seconds. She is balancing. There's no swaying from side to side. She looks like she has got her balance good, which is the Romberg test. Fantastic. She can open her eyes and go ahead and walk towards me heel to toe for 5 steps, and then turn around and walk the other direction. Great. And while you're walking away, you don't have to walk away any further, but I'm inspecting your back. I'm looking at your sacrum for any skin breakdown. I'm looking at the backs of your legs, the heels, the back of your elbows, any place that contacts the bed for any pressure, sore, or injury, or even the beginning of that. Fantastic. You can turn back around towards me. Do you need to use the restroom? No? Okay, great. So let's have you go ahead and get back into bed for me. Are you comfortable?
Yep.
Great. Okay, I'm going to make sure your bed is low and locked. Are you in any pain right now? No. Okay. If you had a pump, I would check to make sure that the pump was running and that it didn't need any tending. I will bring your table over closer to you. Do you have anything else that you need? Okay. Here is your call light.
Thank you.
That is there for you. The practitioner will come in soon and meet with you. If you need anything, let me know. You can just go ahead and press that call light. So you've got position, pump, and sessions, and pump. Fantastic. Okay. Wonderful. I'm going to go ahead and perform hand hygiene. Would you like the door open or closed, Dr.
Close, please.
Closed. Fantastic. I'm going to go and document and close the door for you. Let me know if you need anything.
Thank you.
And we are